Okay, so in this part two of hypertension drugs, we talked about central acting drugs. We talked about drugs like alpha and beta receptor blockers. Now we're going to talk about vasodilators. So direct vasodilators, there are basically two types of them. Some of them that work, let me make a better line for you, my friends. So these work on, some of them are either only on veins and some of them are veins and arteries. So some of them are only on arteries versus veins and arteries. So what's the difference? Well, remember that the blood in the veins goes back to the heart, and that's part of the systolic blood pressure. So the drugs that act on both veins and arteries affect systolic and diastolic, versus the ones on arteries are just diastolic, because arteries are what push the blood from one side, from the arteries to the veins. So that is part of the, that depends on a total peripheral resistance, which is part of the systolic, versus, which is part of the diastolic, excuse me, versus systolic depends on stroke volume. Sorry, yes, systolic depends on stroke volume, and stroke volume depends on the blood in the veins. Blood from the veins, right? If you have less, if the veins are really dilated, the blood is going to pool in the veins, so it's not going to want to go back up to the heart, which means that the stroke volume is going to be less because there is less blood in the heart, versus, or there's less preload, you can call it. Versus diastolic depends on how much blood you can push from the arteries to the veins, right? So diastolic. So that depends on the total peripheral resistance. So let me put this in a different way. So systolic depends on the end stroke volume, or preload. Sorry, not end stroke volume, excuse me. That depends on preload, and that depends on veins, versus diastolic depends on TPR, total peripheral resistance, in arteries. Okay, so the blood, the drugs that do both are nitro. Let me make this better for you. Nitroprusside, and the drugs that are simply an arterial dilator, those are hydralazine, diazoxide, and also minoxide. So remember, minoxide and dioxides, the mechanism is calcium channel blockers, and hydrodiazide and nitroprussides work with releasing nitrite oxide. So how do nitrite oxide works? Remember that what nitric oxide does is that it goes through a bunch of reactions. Basically, it inhibits the phosphorylation of light chain kinase, so you can't have, so basically the myosin cannot interact and you can't have a contraction. The way the potassium works is that they pretty much hyperpolarize the cell, so the cells cannot be, the smooth muscle cells cannot be contracted, so hyperpolarize the cells. Okay, so those are your direct vasodilators. Now you have the calcium channel blockers. Those are also interesting because there are two kinds of calcium channel blockers. They all end in dipene, and there are two kinds. Why do we call them that there are two kinds? Well, let me try to make this in a better way.